Good afternoon. Lee Harris on behalf of Shelby County Government and Joint Task Force. We're headed into the summer months, and during these summer months, it is critical that we continue to make progress on the vaccine front. We know it's going to be a long slog from here on out, and it's going to take continuous incremental efforts. Part of that effort, I want to remind everyone, is the effort to bring the vaccine to those who are homebound or disabled or shut in. The City of Memphis and Shelby County government have worked hard to bring vaccine access to homebound seniors and to adults living with disability. On the Shelby County government side of things, I want to remind folks that the Shelby County Division of Community Services and our Aging Commission have been doing significant outreach to seniors who are shut in. Already, our Aging Commission has made direct calls to approximately 2,500 seniors or persons who we know are in need. We have been calling those seniors who already receive in-home services like home-delivered meals to see if they are open to receiving the vaccine in their home. To date, about 152 persons have received the vaccine in their home due to those phone calls. Additionally, we have done outreach to around 50 senior living facilities to offer the vaccine to their seniors who are in residence. And so far, we've been able to make arrangements at 10 senior living facilities through those efforts. Each one of these programs is relatively small when juxtaposed against our 700,000 vaccination goal. But each one of these events adds up, and it is the way we will continue to make progress. I've been in a few campaigns, and I know that if you want to knock on 10,000 doors, the only way to do it is one door at a time. Our homebound efforts have delivered more than 3,300 doses of COVID-19 vaccine to seniors and their caregivers through this effort. This is the work that will ultimately add up. So, if you know of seniors or disabled persons who receive in-home services right now, please talk to them. When they get a call or an offer of the vaccine, we need them to pick up the phone and we need them to consider vaccination. Additionally, we know that we don't know about every senior who is in this situation. So let's put up the slide. So if you are a senior who is homebound or shut in, please feel free to call us. Let us know about your situation and let us help you get access to this important vaccine. If you run a senior living facility and you want to see the vaccine offered to your residents on site, call us and let us help. Finally, I'll say that Memorial Day is coming up. I can't think of a better time to travel, domestically that is, and a better time to get with friends and family and so forth, which means that this Memorial Day weekend is also a great time to get a shot. Because if you get that shot, it'll give you great comfort about your Memorial Day plans. It'll allow you to greet and hug your family and loved ones. If you're not inclined, if you're not a big hugger, I don't know if David Sweat is a hugger. If you're not a big hugger, then if you get the vaccine, you'll be able to take off your mask and maybe give your friends and your relatives a dap, as they say, at least as I think they still say. With that, I'll invite to the podium David Sweat, who has been leading our COVID response. Thanks.
Thank you, Mayor. And yes, David Sweat, Deputy Director, Shelby County Health Department. As far as hugging and dapping and hanging out with people, I'm absolutely in favor of it. For those of us who have been vaccinated, we can do that freely and safely and feel confident that we're not putting anyone at risk. And that's one of the great benefits of the vaccine. As far as the numbers, let me just jump straight in. We're at 98,298 cases that have been diagnosed here in Shelby County. We've had 7,441 cases diagnosed in Tipton County, Tennessee, 5,144 in Fayette County, Tennessee, 22,044 cases diagnosed in DeSoto County, Mississippi, and 5,728 cases in Crittenden County in Arkansas. As far as on the vaccine campaign front, well, also I will say that we do have 1,668 deaths in Shelby County residents from the COVID disease, and that includes 5 new deaths from last weekend. So it is still a sobering reminder that all of these deaths at this point in time are entirely preventable. And no one has to die from COVID disease anymore. And unless, I mean, you have the opportunity to be vaccinated, and that's the way to protect yourself from severe illness, hospitalization, and death. All of the vaccines are very effective against those things. And so far, we've had 351,989 people in Shelby County be vaccinated and documented in the Tennessee Immunization Registry. 83,912 people are partway through their two-dose series, and 268,077 people are fully vaccinated. But right now in the vaccine campaign, we're averaging a little over 2,000 people a day getting vaccinated in the community. That is a slowdown from where we were a few weeks ago at our peak. But what is important is about half of the people getting vaccinated right now are actually getting it from the pharmacies, from their doctor's offices, in the healthcare system otherwise. So it is becoming more and more the case that it is a routine part of healthcare. It's a routine immunization for us now, or it's headed in that direction. And we will continue to offer community pods. We will continue to do outreach efforts in pop-up vaccination events. We had one just this last Sunday that was trying to get vaccine to our Latinx population. And we had 382 people come out to be vaccinated on Sunday afternoon, and that included 217 people who got first doses. So we'll continue going out in the community in a variety of ways, and also continue maintaining for now the Pipkin building and a couple of other sites as fixed sites that you can always know are going to be available to you if you are ready to come out and be vaccinated. But regardless, we're going to continue to outreach. We're going to go out in the community. We're going to serve those who are homebound. We're going to partner with employers. We're going to do whatever we can to bring this life-saving vaccine to our people in Shelby County. And right now, 50% of the campaign goal has been reached. We're at over 352,000 vaccinated individuals. Thank you to all of you who have gotten the shot. But we're only about 37.5%, 38% of the way vaccinated in terms of our population. And if you've seen any national news stories lately about vaccine, you know that 25 states have reached the 50% threshold where, you know, in half our country, half the population is vaccinated. And unfortunately, we're not at that point in Tennessee. But we're going to continue to offer the vaccine, and it's a life-saving vaccine that can also bring you closer together with your family, friends, and loved ones, and your coworkers more safely. And therefore, we invite you, if you have not yet been vaccinated, please do come out and join us. With that, I will open it up for questions.
Kelly Roberts, WMC.
Hello. I wanted to ask something about a couple of the vaccination sites planned for closure this week. I believe the Gill Center site in the Fraser area and the Greater Imani area site in Raleigh. Now, these sites are close, if not kind of in the area of those zip codes that were pointed out last week, those 5 zip codes that have the lowest uptake. Can you talk a little bit about the options that people in those areas may have if some of these fixed sites that may be closest to them are going to close, maybe the decision to choose those sites to close?
Well, thank you for the question, and I would actually ask you to redirect that question a little bit to the city since they are running the vaccine campaign. I don't want to speak for them since I don't know exactly what the thought process was that led them to the conclusion that those sites were ready to be closed. Those are communities, that is an area of Shelby County where we are concerned and still want to reach people. But if there is not a demand, I understand why the city may make a choice to say that we need to pull back from those fixed sites. However, I'm not entirely sure what their thought process was, and I would ask you to ask the city that.
Thank you. I will do that. I was surprised someone wasn't there today. My second question is dealing with this, now that we have over 350,000 people vaccinated, at least partially vaccinated, halfway to our campaign goal. I know that that original goal is, what is it, about 700,000 people by August 1st. It seems like with the 2,000 a day, we aren't exactly going to reach that. But I mean, what's your outlook when it comes to reaching that original goal? How soon do you think, if we look at the numbers that we're seeing now, that we could see that?
Right, thank you for the question. In terms of a goal, like when we set a goal, whether it's a goal in life or a goal for something like a vaccine campaign, we certainly want to have something to strive for, something to shoot for. Now, that goal is the point where we know that if we reach that number, more than 70% of the people in Shelby County would be vaccinated, and therefore we'd be approaching the concept of herd immunity. As far as if we reach the goal or we don't reach the goal, or how soon will we reach the goal, I think the important thing is to have a target to strive for, and then we will adjust our strategies, just as the mayor discussed earlier. If we have to go to people's houses and do shut-in vaccinations at where they live, we helped 300 people do that. We'll keep reaching out and trying to be creative in ways to get our population closer to the goal. But the goal is really about getting our population safe to the point where the virus is having trouble transmitting and can't sustain itself. And we will not stop working until we get to that point, however we get there. And I'm not going to worry too much about the numbers day to day. I would love it to be higher. But I'm very happy to see the healthcare system, the pharmacies, the doctor's offices, and other venues that people are already accessing healthcare become more active in the vaccination process, because that may be the important thing for a lot of people. They may not want to come to a pod site or sit in their car and drive up and have a stranger put a needle in their arm. That may not be their desire. But when they go to their doctor for other reasons, and can have a conversation with the healthcare provider that they trust, and that provider happens to have the vaccine available and can persuade them to go ahead and take the shot while they're there in the office, that may be the way to reach folks. And so we're going to continue to partner with anyone and everyone that we can to keep trying to make life safer for as many Shelby County residents as possible.
Andy Rock, Fox 13.
Hi, good afternoon. Some recent data from the CDC shows that a lot of Mid-South states are ranking near the bottom when it comes to how many people are getting vaccinated in comparison to other states. It says that Mississippi ranks last and Tennessee and Arkansas are pretty close to that. So I'm just wondering, why is it a challenge more so here to get people vaccinated, and maybe what are some obstacles that we're facing maybe other states are not?
Well, we don't know. I mean, in terms of all the different reasons, there have been a lot of speculation. Some of it may be due to historic, beliefs or experiences with the healthcare system that have been adverse for some of our population, and so therefore there's not as great a trust level. So we have to work harder to build and bridge that gap. For others, it may be, a certain philosophical or political worldview. I don't know. What I do know is that we will keep offering the vaccine and keep showing evidence of its efficacy in an effort to continue to outreach and bring people on board with the idea of getting vaccinated. Whatever our challenges are, we will continue to try to work against them. But, we do all that we can. And it takes two, right? It takes the person on the other side to agree that they want this service. And we can't force it on someone, but we can continue to try to be persuasive.
All right, thank you. And my second question is, as restrictions loosen up, do we know of any restaurants or businesses who are creating vaccinated only sections? I saw some reports of just places in other cities doing this, and I was wondering if you've heard of this happening here, and if you recommend this, and if there's any benefit to doing that.
I've not heard anything about that one way or another. I've certainly not on my radar screen. Various folks around the country have tried different things. I know that in New York City or New York State, they have a vaccine passport. That's an active thing that they're doing in that locale. we're not doing things like that in Tennessee. I think you have to match your intervention efforts to the population that you serve. And so I would encourage all of us to be creative and thoughtful about that. But there's no one size fits all solution for the entire United States. We're a lot of different kinds of folks with a lot of different kinds of beliefs and practices. So we have to, respect that.
Sam Hardiman, Commercial Appeal.
Hi, long-time listener, first-time caller. All kidding aside, I couldn't help but note that both you, Dr. Sweat, and you, Mayor Harris, were talking about the upcoming holiday a little bit differently than you've talked about most holidays in the past year. Could you reflect a little bit on maybe the journey that we've gotten where we can actually have gatherings on Memorial Day and you're not begging people like you have in the past to stay away from each other?
Right. Thank you, Sam. And I'm going to invite the mayor to speak to this as well. I mean, one of the things that I said last time or last week was we need to enjoy the benefits of the vaccination effort, and we need to appreciate and reap the rewards. And I do agree that it is time for those of us who are vaccinated to resume as much of our normal life as we can. And I'm very grateful to all the people in Shelby County who have stepped up and said, yep, I want to help us all get there, and I want to get that vaccine, because that is the thing that's making it possible. We're averaging 89 cases a day. Our reproductive rate of the virus is now at 0.85. The numbers are trending in the right direction, including in the hospital. And I think that we all deserve to reap the rewards of the hard work that a lot of people have put into bringing us to this point. And so, I'm just grateful for that, and I want to applaud and encourage people to gather together safely. And if you're fully vaccinated with a group of your friends, enjoy the weekend. But Mayor?
Yeah, I agree with David that I think that we all have an opportunity to enjoy our lives and go back to pre-pandemic pursuits, assuming we are fully vaccinated. And so that is a very different outlook from previous holidays and from last year and the prior months. There's no doubt about it. So I'm looking forward over Memorial Day weekend. I'll be traveling on Memorial Day weekend. I'll be going back to the movies. It's been a long time since we have been back to movie theaters, and I'll be going to see whatever is coming out. And I don't care what it is. I'll be in the movie theaters seeing it this weekend. I'll likely take a trip or two to Target, because that's what people do. And I'll likely go to Target without my mask. Although I will be respectful of those who are not quite there yet and have not transitioned yet. But I will make a decision to wear my mask or not wear my mask, because I'm fully vaccinated. And so it just points to all the different activities that one can enjoy right now if they are fully vaccinated. So we want to incentivize people to do both those things, to get vaccinated and to return to a lot of the pre-pandemic activities that they enjoyed.
And my follow-up question would be for you, Mayor. Do you think the state of Tennessee could have done a better job of incentivizing vaccines?
Oh, absolutely. I think that in terms of the state data, I think they speak for themselves. And you heard a question on that score a few moments ago, that unfortunately, in terms of statewide data, we have lagged behind other states. And so there is no doubt that that requires a more expansive and more aggressive response, including, as you suggested, incentives.
Hannah Gravenstein, MLK 50.
Good afternoon. My questions are mostly about the case numbers right now. I know we are experiencing pretty good case rate, pretty good positivity rate, pretty good reproduction number. I'm just wondering, for my first question, I know that, we have a pretty substantial portion of the community that has prior has been infected and therefore has natural immunity. I mean, could we be approaching herd immunity at this point?
Yeah, Hannah, thank you for the question. We're looking forward. There's been a study going on with AEL and the University of Memphis, American Esoteric Laboratories, and the University of Memphis, where they look at antibody levels in blood samples to try to determine what percentage of the population has evidence of immunity, and they're able to distinguish whether that is naturally acquired immunity from infection or that's immunity induced by vaccine. So they do their analysis once a month, and they do it in the last week of the month. So this is the week that work is going on in that study. We look forward in early June to hearing what their results are at this point in time. But there's a couple of things still want to remind people of. The immunity that you acquire from natural infection, from having the disease, does not last. It wanes over time. What we don't know yet, but we'll find out in the next few months, is how long does it persist? And that's a matter of academic study. Researchers are trying to figure that out. But what we do know is that getting the vaccine gives you a higher level of immune response, and that it is a more persistent level of immune response. In other words, it's expected to last even longer than whatever you get from natural infection. As you may have heard Dr. Bruce Randolph say, there's also studies that show if you have had the disease, but then you get the vaccination, that your immune system is supercharged at a much higher level. In other words, the shot boosts your immune system above and beyond what your body has already created for itself. So for all those many reasons, the public health guidance is even those who have had the disease are still encouraged to get vaccinated, because it will make their immune system stronger and it'll make their immunity last longer. But are we close to herd immunity? I think we are closer to a point in time where it is more difficult for the virus to spread, but it's not difficult enough right now, because we're still getting about 89, 90 cases a day being reported to us every day. We had 5 deaths last weekend, and those are all preventable deaths. They don't have to happen anymore. We also see that the vaccine campaign has only penetrated above 50% of the population for the age groups that are 45 years old and older. So our younger folks are still very much at risk. And so we're not out of the woods yet, but the trees are thinning out, and we don't want to fail to recognize progress that's been made. We want to be grateful for that progress.
Thank you. My follow-up question is, I know last week and the prior week you had been speaking a little bit about the racial breakdown in the new cases, the age breakdown in the new cases, and I was wondering if you had any updated numbers on that?
I don't have today. I will have on Thursday. But based on the analysis from last week, 77% of our cases that were recently diagnosed were among our African American residents. 56% of them were in people less than 35 years of age. 22% of them were in children less than 18 years old. So that analysis is being redone today even, and so by Thursday I'll have updated numbers on that. But the point I was making last week remains true, that it's not a homogeneous benefit across the county. Some people are doing better, some places are doing better, and other populations are not as well protected yet. So we need to continue to do the work to try to reach everybody with the life-saving benefits of the vaccine and efforts like that.
Those are all of our questions today. Are there any closing messages?
I can only say I hope you have a very happy Memorial Day weekend, and go Grizz. Mayor, do you have anything? No. All right, so thank you. We'll be back on Thursday.
Thanks, everyone.